You're listening to Heal DC. This is Joni, and right now we're going to hear a little music from Elise Bryant.
All righty. Sia hamba. Sia hamba con canyene quincos. 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 Sia hamba, hamba, sia hamba. Sia hamba con canyene quincos. Sia hamba, hamba, sia hamba. Hamba, sia hamba, kinkunyene, quinkosi. Now, sia hamba means we are marking. So some of us folks got together and did some healthcare verses, and they go like this. We are gonna win with healthcare now. 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 We are winning, winning, we are winning. Winning, we are gonna win with healthcare now. We are winning, winning, we are winning. We wish we are gonna win with healthcare now. Are you happy with your HMO? 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 Are you happy? No. Are you happy? Oh, how are you happy with your HMO? Are you happy? No. Are you happy? No. Are you happy with your HMO? Single payer is the way to go. 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 Single payer, payer, single payer. Payer, single payer is the way to go. Single payer, yes. Single payer, yes. Single payer is the way to go. Last verse. We will win when everybody's in. 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 We will win. Yes, we will win. Yeah, we will win when everybody's in. We will win. Yes, we will win. Yes, we will win when everybody's in. I'm so honored to be here with Kay and Linda Ray Murray. Thank you so much.
And let me introduce everybody. This is Joni. I cannot be more excited about the hour in store for you right now. We're going to be talking about the National Day of Action for Single Payer Healthcare for All that took place on Saturday, this past Saturday, with more than 25 cities involved. We're going to hear an exciting feedback from Kay Tillow. But before I introduce Kay, let me just tell people who don't know, you just heard Elise Bryant, who is not only the president of the Coalition of Labor Union Women, not only the head of the DC Labor Chorus, she can also be heard every Thursday here at 1 p.m. with a Labor Heritage Hour. And she is one of my sheroes that are with us today. I am so thrilled to have my three of my favorite sheroes of all time. And two of them I've known for over 50 years. And that's starting with Kay Tillow. Kay Tillow, I first met Kay in Pittsburgh. She is an activist on many fronts, but in the past many years, she's been focusing on single payer, and she's going to share with us what happened on Saturday and a little bit about what's going to happen to come. Another longtime shero of mine, a healthcare shero that should be a household name to everybody, and that is Linda Ray Murray from Chicago. Linda Ray Murray has been active in Chicago for many years. She worked to try to keep the public hospital in Chicago open. She worked for a while in Canada, working on occupational health and safety. She was the president of the American Public Health Association, and she worked very closely with people who helped to create the single payer movement. So I'm so excited to have Elise, Kay, and Linda Ray Murray with us today. We're going to start with Kay Tillow, because there was a very important and exciting actions that took place on Saturday that many of us, at least here in DC, didn't hear too much about, but a lot was going on. So, Kay, welcome.
Thank you, Joni. I'm really happy to be there and to hear that beautiful voice from Elise and to talk about my favorite topic. On Saturday, there were, I understand that there were events in about 30 cities, and I'm not on top of it yet. It just happened, and I don't know all of the news from all around the country, but I'd be happy to share with you what I know. I know that in Pittsburgh, they had a rally at Freedom Corner, and that one of their speakers was Representative Summer Lee, who is the representative from the Pittsburgh area. I know that in New Jersey...
And before we move away from Pittsburgh, Summer Lee is quite an activist, a wonderful congressperson. So maybe in the future we can get a recording of what she said, because she's a very important person that we don't hear enough about.
She is, and she spoke there. I don't think I have a news clip of it, but she was at that event in Pittsburgh, and that's important. She's one of the co-sponsors of the National Improved Medicare for All, the single-payer bill. And then I heard that in Barrington, New Jersey, the New Jersey group went to the office of Senator Andy Kim in their effort to appeal to him to help us to get a healthcare system that will really work. So they were at the office of Andy Kim. I know that in Detroit, they had an event at a church, and I don't know the details on it, but I did see that Representative Rashida Tlaib sent greetings and put out an email in support of the event. So that was, a really good thing. She's the congresswoman from Detroit. She succeeded the wonderful Congressman John Conyers, who was the person who introduced the first single payer. Well, that wasn't the first, but this era's single-payer bill in 2003. So she's following there and was very supportive in her work. I know that there were 3 actions in North Carolina, and that, as a Southerner, that makes me happy. I think people should stop writing off the South and start reaching out to sisters and brothers in the Southern states who, more than anybody, need a transformation in healthcare and to build that up. And so I saw that there was a group called Down Home, North Carolina, and they had an event in Burlington, and it was in the Burlington, North Carolina News that they were fighting for single payer on Saturday. And I think that the San Francisco group going over to the West Coast, they started at Harry Bridges Park or Harry Bridges Pier, and they marched to one of the corporations that, has a lot of the private interest in healthcare, which is our problem. The profits in healthcare are what are keeping us from being able to cover all of our people and making us spend far too much money. And
Kay, tell our listeners who don't know who Harry Bridges was.
He was a leader in the International Longshore and Warehouse Workers Union for many years and really transformed the conditions for the West Coast when they organized that. And for decades, he was the leader. He's no longer living, but he was the leader of that union, which did amazing things. Not only did they improve the lives of their members, but they were out front in fighting against apartheid in South Africa and on every issue that came along. They were leading the way in a very courageous stand of solidarity across the country. So that's, I don't know if it's a park. I'm not too clear on the coast geography.
But I knew that Kay too. I must say all three of our sheroes today are definitely very involved and have been for decades with the labor movement. So I knew that Kay could answer that question.
Okay. And I know there was one in Colorado, and there was one in Kittanning, Pennsylvania, in Armstrong County, which is a county that went for Trump. But they had an event and they had a speaker from the Armstrong County Central Labor Council there. So I don't have all the news yet, but I'd like to tell you a little bit about what we did here in Louisville. Mm-hmm. We had a fantastic event. We worked on it a long time. We're just all volunteers in Kentuckians for Single Payer Healthcare. And we were able to get 17 co-sponsoring organizations. And one of them is the Kentucky State AFL-CIO. One of them is the Derby City Coalition of Labor Union Women. One is shout out to Elise. Mm-hmm. One of them is the League of Women Voters of Kentucky. One is the Kentucky Poor People's Campaign. The Fellowship of Reconciliation of Louisville, and the United Auto Workers Local 862, and the Laborers Union Local 576. And I'm not going to be able to remember all of them, but I want to give you kind of a picture of the breadth of the movement and the extent to which we believe we're coming into a new era where people will once again rise up to demand the healthcare system that serves people, not profits, that removes the insurance industry and venture capital and private equity from our healthcare system, and that places single payer on the nation's agenda. I mean, that was the purpose of it. Many people, because of the very bad situation in our country, have been in despair about what to do. And so what we wanted to say to people is, look, we have majority support for this. We can stand up and make this demand, and the people of this country are ready to hear it and ready to push for it. So that was the effort, to rekindle this movement for an improved Medicare for all, and to put it on the nation's agenda, and to say it is not enough just to stop these cuts. Yeah, we have to do that. They're trying to cut Medicaid and Social Security and Medicare and the VA and science and education and everything that's good in our country. But we have to demand more. We deserve more, to not just stop the cuts, but to end a failed healthcare system and to enact legislation that would actually remove the profits from healthcare and serve all of the people.
And Kay, you are affiliated with a national single payer group. Can you share that name?
Yes, it's National Single Payer. They're at nationalsinglepayer.com, and they're the organization that initiated this action and have been working on it for some time, and who shared the news around the country and began to bring out people to have hope and to say that what we believe is right, we have to put on the nation's agenda. I'm going to quote Congressman John Conyers here. What he said is, single payer is indeed achievable. And then he quoted a number of polls that showed we have majority opinion with us for an improved Medicare for all. I don't know the names of the polls. And then he said this in 2017, shortly before he retired. He said, it is not up to us to move to accommodate and move to the center. It is up to us to stake out the moral center and then invite others to join us there. So we remember Representative Conyers. He had a great deal of wisdom, and he pushed the single payer movement forward in his time. And now we have to pick it up and make it keep going. And I'm very hopeful that people will be inspired by their success over this May 31 National Day of Action, and that we'll find the ways to raise the spirits, to lift everybody up, and to begin to demand a bold solution that is as strong as the ugliness that we face with the lives that we are losing and the terrible conditions that are happening in our country in healthcare.
Absolutely. And that is Kay Tilla, one of my longtime sheroes, calling us from Kentucky. I first met her in Pittsburgh. And as I say often on this show, we have been fighting for universal health care in the United States since right after the Civil War. So this is a long time battle. We launched this radio show, To Heal DC, 33 years ago, exactly to promote the need for single payer health care. And that's the reason we started this show. We worked closely with I'm going to introduce and reintroduce Linda Ray Murray in a moment with Dr. Quentin Young. I worked with him since I was extremely much younger. He was one of the leaders of this movement as well. And so this is a long-term fight, but we're going to keep on fighting. And it looks like we might be seeing a ray of sunshine in this movement. So with that said, let me re-welcome Dr. Linda Ray Murray, calling us all the way from Chicago. Again, has been very active with this issue for many years. And again, I can remember when she was the president of the American Public Health Association, worked very closely with Dr. Quentin Young. But let me let Dr. Murray jump right in now. Welcome, Linda.
Good morning, everyone. How's everyone doing? Glad to see folks.
I can't tell listeners. I'm sorry. I'm so excited to have Linda Ray Murray on. I wish we could have her on every day. But Linda, tell us a little bit about what you're thinking. Anything you may want to share about the history of this struggle.
Well, first, let me just say, I was unable to go to our local demonstration, but I know we had a turnout at the Blue Cross Blue Shield headquarters. And I also know that one of our national leaders from the Physicians for National Health program, PNHP, Dr. Fagan, spoke at that demonstration. And I think what Kay was talking about is important for people to embrace and remember. When you're getting beat over the head, obviously the first thing you want to do is stop that beating, and so we have no choice but to respond to these efforts to cut Medicaid, to these efforts to roll back our understanding of public health and making it more difficult for people to get vaccinations. All of these insults, people getting fired. There's so many insults, people being grabbed off the street because of violating their basic rights. We have to respond to that, and people are responding. But I think we have to respond to it with some understanding of what's really happening and an understanding of what our real goals are. And so let me go back even a little further than single payer. We've been trying to fight for universal health care for over a century in this country. Single payer is our latest and best reform. I personally feel we should ask for what we really need, which is a little different than single payer. I just want to remind people, for example, of the years that Congressman Dellums introduced legislation in a much more comprehensive way than what we're doing now with single payer, that really tried to change how we educate health workers, et cetera. So if we look at where we are and how much the healthcare industry has changed. I'm now retired from seeing patients, but even in my career as a physician, and even though my grandchildren think I'm ancient, it's really not that long in the history of American medicine that I was practicing. To say, there are basic things here that are being undermined. For example, why all of a sudden do we have a lawyer in decision that used to be the stage of experts on whether or not what action is, as we why is that process of discussion and debate suspended because one person has notions that are not verified anywhere about the dangers of vaccine. This is something that takes us back. When we've had 1,000 people already with measles in this country and at least 3 deaths, that's probably an undercount. This is as a doctor, I'm not a pediatrician, but as a physician, to live in a country and have this epidemic that shouldn't exist. No child in the world, really, but certainly not in a rich country like ours that should be coming down with measles. I am old enough to have grown up as a child before measles vaccines existed, and I certainly remember getting the measles, but I also remember the hundreds of children that were maimed and died every year when I was growing up from this virus. So the fact that we are sitting here and acting like this is normal times is really disturbing. And if we're not willing to stand up and say, we have to put the principles we believe in. Do we believe that every human being has a right to basic health care? That's the first question. Mm-hmm. I think most people in the world, and I think even most Americans believe that, and we have to be willing to say, this is something we can achieve. It's not something that's too expensive, quote unquote. It's not. We can do this if we make a decision as a society to put our resources to the good of the people rather than to enriching the billionaires.
Absolutely. And you're listening to Dr. Linda Ray Murray, a longtime activist for universal health care for all, single payer, and more. Again, she is my number one hero in the healthcare movement. And I remember, of course, I was very involved when Ron Dellums proposed his bill. And that was thanks to another friend of Linda's and mine and Kay's, and that is Peter Orris. Actually was the one who asked Ron Dellums as they were sitting on a plane together if he would sponsor a bill that would really talk about the need for universal health care in this country. And we worked with him for quite a while. Ron Dellums was on this show talking about healthcare issues many moons ago. But I think the issue that we should be focusing on today is how do we step up the organizing? We know that the majority of people in this country, and this has been true for decades, I think it's something like 80% or a very large number of people in this country would support a universal single-payer healthcare system. So it's a matter of the organizing. I'm going to ask Elise. Elise, if you want to jump in and anything you'd like to say, of course, Elise wears many hats, and as the president of the Coalition of Labor Union Women, we know that, and she knows that certainly labor has a key role to play. But anything you'd like to say, Elise?
Only that I'm just really excited to be on this program with these two fabulous sisters, and that this is the work that we've been called to do. And there's no ifs, ands, and buts about it. This administration is literally done what the word apocalypse actually means in Greek. It means to tear the curtain off. And they have torn the curtain off. They reveal exactly what they believe in, which is like, we're not going to take care of you. We're not going to make sure you have what you need in terms of health and medical needs, because your life isn't that valuable to us. You can be replaced. And we know that, and we know in the labor movement, it's not as easily replaced as they thought. And I think they found that out as they started getting rid of federal employees, which was just a shocking, terrible crime. And I'm really excited about the work that we're doing and working with all those who demand that this is the United States. America, we have a responsibility to.
Absolutely. And speaking of federal workers, we actually are going to be on for the second hour talking with federal workers about an upcoming town hall they have and more. So Elise, well, all three of these sisters will be with us in spirit in that second hour, focusing on labor and an upcoming important town hall about protecting our federal workers and protecting ourselves. But Elise, we'll come back to you. If I think one question is,
Real quick thing, I can ask Joni, don't mind, because this came to me when we started, is that years ago, I was at an environmental justice conference in Detroit, and Linda spoke. And one of the things she said was, if we didn't learn anything else from the 60s, we need to recall that any effort to bring about real change requires multiple interventions. There is no one solution. We have to have multiple interventions.
Absolutely. Absolutely. And Linda, do you want to comment on that? And then we'll go back to Kay in a moment too.
I'm impressed with Lisa's memory. So, but actually, it's a good thing to bring up. I think for many, many reasons, partially because we've been successful as a series of movements, not as successful as we need to be, but we've certainly made some progress and been pushed back. I think we have to ask ourselves as organizers, organizing is not just calling people and taking them to the polls or, putting out on social media that we're having a demonstration at this place and time. We can do that. We have to really, what did people do before 1960? What did people do before 1860? Okay. What did people do before we had the infrastructure that we've had in the past 75 years? There was an abolitionist movement in this country in the 1600s. What do we know about that movement? And especially, what did oppressed groups do in the 1600s and 1700s and 1800s in this country? What did Native Americans do? And so when we look, that's what I call the infrastructure of not just resistance, of fight back. What's the infrastructure? What do you need to do that? The Highlander Center existed, I think, for decades before we began to see bus boycotts in Montgomery. And
tell people who tell our younger folks.
The Highlander Center was a center. Actually, I'm bad. I should be careful what I say. I don't remember who sponsored it, but it was a center that taught folk music and also organizing to many leaders in the South, and it was one of the few areas where you could bring people together in the South of different races and have a discussion about the problems they faced. And that went on. They were not painting picket signs at the Highlander Center, but that builds the foundation in people's leadership skills.
Yes, and that's a good point, Linda, because we really don't have a place that's doing that now. And of course, the Highlander Center, Rosa Parks came there, Dr. King, and many others. And I'm sure Kay has experience as well, direct experience with the Highlander Center. You're listening to WPFW 89.3 FM. This is Joni with Two Heel DC for our first hour, 10 a.m. hour, where we're talking about what happened Saturday, the nationwide campaign for single payer that came on, took place in over, I would say, 30 cities. And then where do we go from here? I'm sorry, Linda, you want to finish up your thought? Or you want
Well, yeah, what I wanted to say is that we have to be aware that a lot of the infrastructure that existed, say, after World War II has been weakened. Churches are smaller. They're less vigorous than they used to be. A lot of the civic organizations no longer exist. Even places to have a meeting on a Saturday. It's one thing to go to a church basement, but if your churches are weak and they're not open on Saturday, okay, that's a problem. Unions have less visibility in many of our communities today than they did in the 50s and 60s. And so we have to work to build that infrastructure. We just had a training here in Chicago a couple of weeks ago around immigration issues. And one of our big challenges was finding just a place to meet on Saturday morning. Now, we were able to use a SEIU hall, which was good. But again, we have to spend time on this organizing infrastructure, places for people to meet and talk, skill building sessions for people to learn these skills, in addition to continuing national days of protests, etc. So we have to do it all at the same time, what the young people call multitasking. We really have to do that because we're really under attack. But we can't simply do the things that are on the evening news and ignore building the infrastructure and training of new generations, because we have to do both. Otherwise, we'll lose.
Absolutely. That's Dr. Linda Ray Murray calling us from Chicago, has been involved. And again, she's been my number one shero for a half a century. So I'm happy she is with us together with Kay Tillow. And one thing I'll say, Linda, is that actually here in the D.C. area, some of the churches, quite a number of our churches, are very involved. And I don't think we have problems getting space for meetings. They're out there on the front line. And I think, Linda, you recently had one of these big protests. I think Chicago, maybe perhaps it was against the genocide in Gaza, had tens of thousands of people out there in the streets. So you're doing well getting those folks out. But we have to continue with the organizing. Kay Tillow, again, Kay is one of the leaders of the national campaign for single payer, was very involved with Saturday's Day of Action for single payer. Kay, what would you say about the need for continuing to strengthen our organizing around the need for healthcare, single payer healthcare, and perhaps lessons we can learn from the past about effective organizing?
Well, I would like to agree with Dr. Murray on a couple of things. She spoke about going beyond single payer, and that's something that many people are now talking about, is to make sure that we take the profit out of all parts of our healthcare system, the for-profit hospitals, et cetera. So that's indeed a part of the campaign. Yesterday, our topic was health, not profit, and to remove the profits from the healthcare system. So she's right about that. And National Single Payer is now having discussions about, can we improve the projected legislation, and looking at the Ron Dellums bill, and looking at, I think Barbara Lee carried it on
yes.
there. And all of the things about what can we do to get the model legislation that we really need, and to build the movement. That's the key, and the people have to understand, we're always getting derailed by someone who comes along and says, oh, you don't have to take the profit out. We'll just, build on the system that we have. And when people say that, it shows they don't have an understanding that the money that is being put into our healthcare system is leaking out into the hands of the medical industrial complex that is taking their share of the money and constructing barriers that are blocking people from getting care. So we see, there's prior authorization. It's not what your doctor says, it's what your insurance company says. And if they say that you can't get this treatment, they're not going to pay for it, we are stuck. We're stuck in a system that isn't working. And it's not something that hasn't been solved around the world. I mean, industrialized countries and many that are not industrialized have established single payer or national health service systems and are doing much better job of taking care of their people. We live, I think, 5 years less in this country because we're not getting care and health to our people. So we have to do the organizing, but we have to help people to believe again that the people can have some democratic impact on this country. I was fortunate enough to have been at Highlander Center and
That's what I thought. Yes.
met my future husband there. That's why this Kentucky woman is married to this New York City guy, because SNCC brought all kinds of people together during that time,
And Kate, I'm always surprised. Not everyone knows what SNCC stands for, and that's the Student Nonviolent Coordinating Committee, very much a part of DC and our radio station. A shout out to our own Dory Ladner, who was activist at SNCC and heard always on this station. But share a little more about the Highlander Center and why that was such a good, as Dr. Murray was saying, it was a great place to teach people about organizing.
Well, I think that, back in the 30s, it was Miles Horton and Don West who established it to build unions and to bring in rank and file people. I mean, it was based on the concept that ordinary working people have intelligence and capacity to do marvelous things within our country. And we just have to give them the ability to organize and to move. And so it was a pro-union in the 30s. In the 60s is when I was there. And at that point, it was involved with a great deal with the civil rights movement, with Rosa Parks and all kinds of things. It was also involved in literacy. There's a woman named Septima Clark who was active in bringing literacy to people across the South, and it was involved with voting rights and everything. But, it's based on the idea that we, the people of this country, have the ability to make the changes. And we shouldn't sit back in despair, but find the ways to bring our fellow sisters and brothers into activity and into expression and into pushing it forward. And I believe that it's possible. And now it has to happen because we are in such big trouble with the environment, with the pollution and with the effort to destroy our unions. All of these things, if we don't fight now, we will lose what past generations have said to us. And we can fight, and we have the ability to do it. And don't give up on people. Help people to come into their own and to express the things and to organize for the things that we all have a right to.
Absolutely. And Rosa Parks, by the way, I think she learned a lot of what she used in Montgomery. She actually learned that in the Highlander Center, as I remember. But Kay, let's all talk a little bit about how do we mount this battle to save Medicaid, which is our most urgent threat right now, and protect Medicare, and continue to organize for what we really need. Any thoughts about how do we link all those together in terms of our organizing?
Well, I don't know. We had Dr. Karen Krieger in Louisville who spoke at our rally, and she brought with her posters that had the senators' phone numbers on them because the battle right at this moment is that this bill that would make all these cuts was passed in the House, and it will be going to the Senate, and maximum pressure must be put there. I think that the Poor People's Campaign is working on that as well, but we should put as much pressure as we can in the streets and on the phones and whatever you have to do. And then we have to go on from there, because I think that the battle to take profit out of healthcare and to pass single payer, if we build a movement that demands that and understands that, that will be a big, big help in defeating the cuts. I mean, there's nothing that they will hate more than that the people are demanding and understand the need to remove the profit from healthcare.
Yeah, so that the people are united. And one last thing before we go back to Dr. Murray and Elise. you sent me this morning, which I didn't have time to listen to, several speeches from Saturday. Is there any way that listeners might be able to access some of those very powerful talks that were given around the country?
Oh, well, I will try to, I'm sure that that'll be up on nationalsinglepayer.com, and I'll try to get it up on the kyhealthcare.org. I don't have it yet, but we have speeches from the Kentucky State AFL-CIO and from a number of auto workers who attended our rally, where Ron Hargrove, who is local 862 of the UAW, came and made video for us. It's just a fabulous thing. So, I would say go to nationalsinglepayer.com and see if we can get some of the video up. We did get news coverage here, and we were delighted that
that's terrific.
Whole segment on the Spectrum News about all of the events.
Okay, terrific. Well, we're going to be running out of time soon, but let me quickly jump back to Elise and then back to Dr. Murray. Elise, any thoughts that you might have about how to continue to bring in the labor movement on this battle around healthcare, or anything you'd like to say, Elise?
I don't think we have to bring in the labor movement.
Sorry for yes, and actually labor is, and we'll be hearing from labor in the second hour. So the whole next hour is going to be with people from the labor movement. But obviously the labor movement, we've been saying this, and Dr. Murray knows as well, that Dr. Quentin Young, and maybe Linda can say a word about him. He always said, said for many, many decades, that we could never win for a universal health, single payer health movement without labor. It's never happened in any other country in the world, and that's certainly true today. So Elise is correct. Labor is involved, and thank goodness. So
we have no choice.
Yes, we don't have any choice. We need our health care. We need our basic services to live our lives. Dr. Murray, you can jump in, and then we're going to move in a moment to final comments. But
let me try to be succinct. So this is a conversation amongst family. I think we are still using bad practices to deal with this. If we concentrate, instead of centering Medicaid cuts or centering the illegal firing of thousands of federal workers, we should be centering the basic principles, taking the profit out of healthcare, guaranteeing American workers the right to organize. We still don't have that in this country. And there are so many things that are barriers to the ability of workers to organize, even labor unions. And until we center the principles clearly, because the battles are going to change depending on what idiots are trying to do what to us. So yes, we should oppose Medicaid cuts, but we've already privatized Medicare. The majority of people in this country with Medicare, which is historically and still the best insurance system we have in the country, have been tricked into these Medicare Advantage plans, which undermine even our poorly constructed Medicare program. So we have to be clear, and we have to say every day, no, we need to take the profits out of healthcare. We need to be sure that people don't starve to death, whether it's in Gaza or whether it's on the south side of Chicago. We need to make sure that people have a right to organize and protect their rights in the workplace. And as we do that, then we can talk about these other battles that come up. Because Medicaid, I'm concerned about Medicaid, but if this bill goes through in the Senate, it will be, for stupid reasons, but because of budget reconciliation and pay as you go, it will undermine payment, the financial structure of Medicare, which is a whole community that it's not that, the policy wonks have thought of this, and those of us in healthcare are worried about it, but the general public isn't even aware that there's a connection between Medicaid cuts, which generally they oppose, and undermining the best system we have yet for a segment of our population. So I think we have to change our strategy, and we have to center the principles that we believe in and that we fight for, and use those principles to engage in battle on a whole range of fronts. When we do that, then it becomes possible to connect the cuts at NIOSH, which put in danger all the firefighters in this country, with cuts in SNAP, our food stamp program, with cuts in Medicaid. If we don't center our principles, then these just look like separate fights. And we know that they're not separate fights. We know that they're connected, but we have to find a way to express that daily in what we do and how we organize.
Yes, absolutely. And Linda, what is the deadline for this situation around the bill that may do all these?
This is our president's, what does he call it? Big and beautiful.
Beautiful bill.
So my understanding is that the economists have argued if these cuts take place, that this will trigger this pay-as-you-go thing that Congress passed a few years ago, and it will force a decrease in Medicare, for example. But there are other sort of sitting bombs and all of this nonsense, because what they're doing, I mean, think about the attacks on the university system. You know, you could easily say, well, why should we be concerned about that? But they have a plan, the right wing, not Trump. I'm not sure he can think, but they have a plan that allows them to get more and more control over our country and more control over money here and around the world. And again, we have to begin to articulate clearly what we need as human beings and what we believe in as human beings as our major way to organize.
Absolutely. You're listening to Dr. Linda Ray Murray, calling in from Chicago, one of the, I would say, great heroes of healthcare in the last, last half century. He's done many, many, many things. And also Kay Tillow and Elise Bryant. I'm going to make an announcement to make sure I get this in. We're going to hear in a moment our closing song by somebody named Pam Rogers, and in a group called In Process, which Elise is close with as well. And Pam Rogers is going to sing our outgoing song, Healthcare for the People, which we actually created when we first started this show. And Pam Rogers and In Process is having a community sing. That sounds like something we need about now. Sunday at the People's Congregational Church, 4704 13th Street. And that's from 2 to 4 this Sunday, June 8th, in the afternoon. A tribute to Bernice Johnson Reagan, who is much, much more than a founder of Sweet Honey in the Rock, was involved with in Mississippi Freedom Movement, Freedom Singers, etc. So that's Sunday from 2 to 4 p.m. at People's Congregational Church. And again, coming in the next hour, we're focusing the total show is about labor, and a very important town hall meeting with the labor folks happening Tuesday, June 10th. So stay tuned for the 11 o'clock hour. But let's have a final word from each of you. Let's start with Kay.
Well, thanks, Joni. Well, I'm thrilled to be able to talk about this, and I hope that the events of Saturday lead people to believe that it's possible to move people and to organize and to demand a bolder stance for the things that our people have to have. And I think it's possible that we will go forward from that and we'll make it happen. I know I just saw that Dean Baker, who's an economist that relates, I think, to the union movement, has now said he's changed his mind. He says he used to think that Medicare for all would not be for many years and we should have other intermediate plans. And now he says, I think it's possible that we can put it on the nation's agenda. And he did an interview with Adam Gaffney, a former president of the Physicians for National Health Program. So I think things are moving and we can do it.
Absolutely. And Kay Tillow, I'm going to try to really have you on a more regular basis and have Dr. Murray on as well as when we can. Kay Tillow, again, tell people how they can find out about the struggle for a single payer. What is the website?
they can go to nationalsinglepayer.com. And on there should be information about the National Day of Action. And if they want to catch up on Kentucky, it's kyhealthcare.org.
But otherwise, it's nationalsinglepayer.com. Okay, Kay Tillow, I love you. You're fabulous.
Thanks,
and Kay, as people maybe could tell, is also a long-time union organizer. Used to be organizing nurses in the Pittsburgh Hospital and much, much more. Elise Bryant, your final word for today. Is Elise with us? Okay.
Sorry about that. Yeah, we're going to win with healthcare for all.
And again, I'm very proud and love Elise Bryant very much. We're thankful that we can hear her all the time. But as it's not said enough on the radio, that she is the president of the Coalition of Labor Union Women, as well as being a fabulous singer and activist. So, Elise, I will see you soon.
All right.
And last but definitely not least, Linda Ray Murray, you have a minute with your final words.
Well, we need to all follow the examples of Kay and Elise and fight harder today than we did yesterday, and make sure we organize better tomorrow so that we can, in fact, win the basic rights that American people deserve.
Absolutely. And I don't know, Linda, is there any way that people can, I don't know if they can follow you or hear more about what's happening in Chicago? You have still some very, very strong activists there in Chicago.
Oh, we have lots of groups in Chicago. I don't want to call one out. And certainly for Single Payer, the organization that I spend my time with is PNHP, Physicians for a National Health Program.
Yes. And again, Linda Ray Murray worked closely with Dr. Quentin Young, who's another very important person in this struggle, who actually Dr. King, Quentin Young was Dr. King's doctor when he was in Chicago. So Chicago is doing some great stuff as always. That finishes up for this hour. We're talking about the National Day of Action that took place just this past Saturday in over 30 cities around the country. National Day of Action for Single Payer. So check that out. Keep knowing that happened. And we're going to move again in the second hour. We're going to talk with federal workers, including what's happening with veterans and what's happening with the VA, and a very important upcoming town hall on Tuesday, June 10th. With that said, we're going to go out with a song, as I mentioned before, by a group called In Process that's having a community sing on Sunday. And this song was our original theme song many moons ago. So thanks, Mikey Masella, and let's hear that. That's this song.
For the people, healthcare for the people, healthcare for the people. Healthcare is for people, not for profit. Healthcare for the children, healthcare for the children, healthcare for the children. Healthcare is for people,
listening to Heal DC, our hour number 2. We're focusing on federal workers on the front line. We'll be speaking with some union activists for the first segment of the show about an upcoming very important town hall Tuesday, June 10th, that will be talking about what's happening with federal workers and federal services and what you can do to change that situation. The second half of the show, we're going to be hearing from someone who is a veteran of the Gulf War, and it's going to be coming to DC on Friday for a very important rally in support of veterans. And that's in our, by 11:30, you'll be hearing that discussion. But we're going to start with a song by Nikki, who is with the DC Labor Chorus and another group called Justice Singers. So take it away, Nikki.
Thanks, Joni. We shall not be moved. We shall not be moved, just like a tree that's planted by the water. We shall not be moved. Federal workers matter, and we shall not be moved. Federal workers matter, we shall not be moved, just like a tree that's planted by the water. We shall not be moved. We'll stand and fight together, and we shall not be moved. We'll stand and fight together, and we shall not be moved, just like a tree that's planted by the water. We shall not be moved.
Thank you very much, Nikki. And Nikki has been singing at many of these rallies. That's one reason alone you should go out, check her out at some of these rallies. And Nikki, anything else you'd like to say before we jump into our discussion with the federal workers?
Oh, just thanks, Tony. Glad to be here. Glad to be here to support federal workers. Wearing my DC Labor Chorus hat. And also Movement Music Project out of the Movement Infrastructure Project. So thanks, everyone. Looking forward to the show.
Yes, and Nikki will be we'll be hearing from Nikki at the end. Okay, we're going to jump into our first segment. We are waiting for April Goggins, our wonderful engineer. Mikey, maybe you can call April, who's part of this segment. But let's jump in with the person who is going to be speaking together with April, and that is Helen. Helen is or was a federal worker and is very much involved with the town hall that's coming up Tuesday, June 10th. So welcome, Helen.
Thank you for having me.
I'm glad you could be with us. Let's start with your situation. You used to work. Well, tell us where you used to work, why you left. And I see April is on. Okay, we'll jump to April in a moment. But tell us where you worked, Helen, and why you left and why you think it's so important that community together with federal workers stand together to make a change.
I'll try to be succinct. I was at the U.S. Department of Labor until April of this year. One of the reasons I left is that under the Trump administration, I wasn't able to do my job. I worked in a small agency called the Women's Bureau, which has been around since 1920, basically looking out for working women, of whom there are more than 70 million in the U.S. And if you know anything about this administration, you know that working women are at best not a priority. At worst, they're not big fans of women in the workplace. So because the new secretary centralized all communications in her office, I had nothing to do. For that and other reasons, I decided it would be better for me to quit my job and do more organizing on the outside. And that's what I've been doing. I'm very excited about this town hall on the 10th. So it's sponsored by the Federal Unionist Network with lots of great partners. And some of the goals are to build deeper connections between federal workers in unions, federal workers not in unions, and other workers. We are all facing the same attacks or will be facing the same attacks soon. I also want to be making connections between federal workers and the community at large, because what's happening right now by Trump and DOJ is not just an attack on federal workers. I would say it's not even primarily an attack on federal workers. It's really an attack on all public services provided by the federal government. So that includes things like Social Security, Medicare, Medicaid, all the programs that keep our air clean and our water clean. And if you think it doesn't affect your life, what's happening right now, it will very soon. And I think that's one of the things that we want to communicate at this town hall, and why everyone from the community, whether you're a federal worker or not, should attend on the 10th.
Absolutely. And we do, I should have mentioned at the beginning that this whole hour revolves around speakers with the Federal Unionist Network. We've worked on this program with the fun since really earlier in this year, but for people who do not know, Federal Unionist Network is a very important organization to know about. And I want to also welcome the person who helped put this hour together, very much involved with fun, is Dante. And Dante's welcome to jump on now or later. And we also have April Goggins. April Goggins, some of you may know, she has been with the DC Black Lives Matter organization for many years, and she's now very much involved with fun as well. So April, welcome.
Thank you. Thank you for having me. Glad to be here.
And I'm excited to have April on. I'd be happy to have her on for the whole hour. I heard her speak at the May Day event at Freedom Plaza. She gave a very powerful talk. But April, you can start out with what you may like to share about your situation or what you see going on, and then we'll jump into the town hall happening a week from tomorrow. But tell us what you're up to these days in terms of work.
Right. So on top of Black Lives Matter and the other things that I do, I'm also the Chapter 250 president of NTEU, the National Treasury Employees Union. And that is at the Administration for Children and Families in Health and Human Services. So I currently represent about 430 employees in DC, Virginia, Maryland, and West Virginia. And so ACF, you'll know, is Head Start, LAHEAP, which is Energy, Office of Child Care, ORR, Office of Refugee Resettlement, all of the grants that come to all of those programs and all of those kids and families. Those are the employees that, and I also clearly am an employee there. The union is what I was elected to do, so I get official time to do that and love it. But what we're seeing is just psychological warfare. Like, I think we have to call it what it is. You know, it's a war against workers. It's a war against trans folks. It's a war just against everything that not before now, but, you know, everything that represents a threat to power and money in this country. And so what I'm saying is, you know, we had our probationary employees and our DEI employees were the first to be let go. And that was just a shock, right? And I think what people also need to know is all of the reasons and all of the paperwork that they got around why was completely false. Like, it was literally just made up. There were sometimes form letters. And then we had around 500 employees who on, you know, April Fool's Day. And let me say that in February, that was Valentine's Day when the probationary and DEI employees were let go. And then on April Fool's Day, we had the folks receive their first RIF notice. And so I don't like to call them RIF employees because they are still employees who received RIF notices. And I think that's really important. And then, just a few weeks ago, the HHS refired them, which was interesting. They sent them another letter that said that they were being fired and they had, let go in a rip, even though they had already had that happen. And so, all of us, including myself, there's just this anxiety that comes every morning that you sign into your work, because that is how everybody found out. You're like, it's today the day, and then there's the atmosphere of fear that you see with all authoritarian regimes, right? Where they try to silence us by scaring us, right? And to some degree, yeah, we have to protect each other because some of us are more targeted than others.
And April, say again where the agency that you work with, if you can say that, I don't know.
The Administration for Children and Families, and that's under Health and Human Services. So HHS, yeah.
Yes, and that you also say that includes people who are here possibly being challenged because of their status, whether they're citizens or not. That's also part of what the agency is involved with.
Yes, we do. We have one of our offices, the Office of Refugee Resettlement, works with undocumented kids, and then Refugee Resettlement works with various communities of refugees. So yes.
So that there must be a lot going on just with that alone, and of course, as I understand, Head Start is in danger of being defunded. Perhaps just go through some, for people who may not know, the services for children and families that are under attack. Right.
So in addition, on April 1st, when the first notices went out, ACF, we had about 500 people who received that overnight. And so within that, 5 of 10 of our regional offices shut down, like whole divisions. You may have heard of the Office of Energy, which is what people are referring to. But their entire staff, their entire team was gone, even though that is the program, if you've heard of it, LAHEAP, which helps folks, lower income folks, able to afford utility bills, heat specifically. You've lost, people who do TANF, Temporary Assistance for Needy Families. Yes, Head Start. And so when you look at like regional offices, they literally, it was locked. They could not go back into work. So they all represent grantees that are also some of the most vulnerable for being the hardest hit all over the United States. And I think when people think about it, they got to know that like all of their stuff is inside. So you have to ask, how are we able to serve those communities if people can't even access the information that it takes to do that? And so this is across ACF, when it's childcare, or any of these offices, you would think, when we all leave a job, we usually are able to transition, right? We're usually able to give the next person our work. This is what was happening with this grantee or this program, but they just couldn't come back to work. They couldn't log on. So all of the, much smaller teams of people who were left then have to deal with an administration that is telling everybody we can do this even better because we got rid of the fraud, waste, and abuse, and we'll still be able to do what we're doing even better now. And so there's not a way to say, like, if you still have your job, that you're just like not gonna do the things, because then they can also just say, hey, that's okay, you don't wanna work, then like we're trying to get rid of people anyway. And so what you just have is like people who were already, because there was already, it's been a freeze for a really long time, and we've already been overworked, and folks, some of our grant specialists have have already had before this 3 times the amount of cases that they should have. They do an incredible job, but now they are having to they're having to be responsible for redistributed work from their coworkers all along, while having to go to work every day to see like their coworkers' offices empty or with new people, if they have an office to go back to. Or and then for the folks who are no longer in the office, every day is like, what you're trying to replan your entire life, like every day. And every time there's a court decision, you're trying to then again, do you have a plan B and C for that? And then every day it's like, okay, this is great, but does this mean our jobs are okay till Monday? Today's June 2nd. So there were hundreds of people who were waiting to see if today would be their last day, right? Because then you have to worry about healthcare and when does that time run out? If you've got kids who, some people are going through chemo, there's a lot of pregnant folks in my chapter and around ACF. Like, how do you plan for that, knowing that you will be pregnant far long after you no longer have that coverage? And it's not like insurance is cheap if you don't have a job. And then there's workers who were forced to be reassigned. So if you lived, quote unquote, 50 miles outside of your office, where your office is, because, a lot of people were remote working, then you had to find a way to come to work. So you've got people who live 200, 500 miles away who are expected to come to work 5 days a week, or obviously be fired. So yeah, I mean, in every way that possible, this has been an incredibly oppressive and violent experience, emotionally violent. And yeah, and then to see now that, as a proud resident of DC, especially Ward 8, is that these things go hand in hand, right? So Head Start, in DC, most of the Head Start programs are here east of the river. And so what you've got now is an entire community who losing access to these services is like life-changing, because without Head Start in the city that still ranks #1 for the hardest city to get childcare in, but also at the same time, folks wanting to downsize programs like Medicaid or like TANF, where you're required to go to work. But how do you go to work if you don't have childcare? And so what we will see is just a massive amount of need and lack that is imposed, right? This isn't a thing that people made a choice to have to rewrite and make A, B, and C plans for their family and for their lives. So yeah, it's all of that.
You're listening to April Goggins, and again, she is a leader with the DC Black Lives Matter movement for at least 5 years, I think.
This is our 10th year.
10th year? It's been 10 years. Oh my goodness. I don't know why I was thinking 5 years, but 10 years was DC Black Lives Matter movement. And now we are very proud and happy that she is very active with the Federal Unionist Network. Fun. Federal Unionist Network. And again, in a moment, we're going to be jumping in with more details about the town hall taking place a week from tomorrow, June 12th in the evening. But I wanted to quickly ask you, April, many listeners know that the federal government so far has been able to, I would say, steal $1 billion from DC's budget.
Absolutely.
How has this been impacting the families and children that you serve, or has it yet been impacting the services that are going to be available for the federal agency that you work with around Head Start and SNAP and services that families need? Has that $1 billion hitting those issues yet?
I I have not heard like immediate where I could say this center, this, that, this, but it will be immediate once whatever impact happens. Because the programs, I mean, most people forget that DC, first of all, isn't a state. So the amount of power and overreach that Congress has on our budget is it just kind of exacerbates the situation by about 100%. And so it'll just be automatic. I mean, all of these things are interrelated. Sometimes when you are eligible for one thing, you're eligible for another, right? Because you might need to eat and have housing. And so when it does collapse, which is exactly what it's going to do, it will happen very fast and it will be across the board. And I think that in DC, it will be a much more permanent, forever changing situation. Yes.
No, let's not claim it as permanent.
Right.
So people are going to be organizing again. We are spending this hour talking with active members of the Federal Unionist Network. In the half hour, we're going to be talking to a veteran about the Veterans Rally coming up this week. But right now, we're going to, in a moment, really talk a little more in detail about what's happening a week from tomorrow, Tuesday, June 10th. But before we move, I wanted to ask April real quick. I'm just wondering, is the union NTI, which I actually used to work with them, are they able to do, maybe this is an unfair question, anything in terms of mental health support for the members?
Great question. So our chapter just started a mutual aid group, our mutual aid team. And I think a lot of the chapters are really thinking about how they can do this. And yes, part of that is sourcing our current members about some of that. We do have mental health folks who are signing up to offer circles. We also have some of our members are part of it's called Well Fed. And so they do a whole lot of work around mental health, support, care, all of those things. I mean, it's essential. So yeah,
that's fabulous to hear it. I'm just going to sneak in this announcement related to mental health. Tonight, someone named Nana Malaya, which many of you know, she's involved with PFW, is having a yoga with meditation event tonight, 6 to 7:30 at the Joe's Movement Emporium. And that includes children from age 5 up to seniors. That is this evening, yoga with meditation with Nana Malaya, from movement to meditation. So these are the kind of things that I'm sure the unions will support. And with that said, we're going to spend the next, until 11:30, we're going to talk about this town hall coming up Tuesday. That's a week from tomorrow, June 10th. And again, I want to thank Dante, who is very much involved with this organizing and helped produce this show this morning. If you want to jump in, please do. Otherwise, we're going to go back to April and Helen, who can definitely share with our listeners. Helen, let's start with you again. Tell the listeners the title of, I don't have it in front of me, the title of the town hall on Tuesday, and where it is and why people should come.
The title is The Battle for Public Service, Federal Workers on the Front Lines. It will be at the John Wesley AME Zion Church, which is on 14th Street Northwest. So June 10th from 5:30 to 7:30. And if Dante's available, I would love to have him talk about it because he's been really core to the organizing.
Yeah, I'm here. I don't know, Joni, if you want me to answer any questions specifically.
Tell our listeners why it's important. They maybe should consider coming.
Yeah, well, this has been sort of a long time in coming, ever since the early attacks on our public services and public sector workforce. I'm a federal worker too. Been a federal worker since 2019 here in DC. And yeah, well, actually, Helen and I, which I'm glad she's on this call, were some of the first folks to go in front of the Office of Public Management, which is basically the HR for all the federal government agencies right next to the White House, and we were doing daily demonstrations late January, early February when Doge started taking over our government. So yeah, when Fun started picking up some of the fight back nationally, Chris Doles and Alyssa Tefty and some other folks, Paul Osadebe, who's also in DC, some good friends that we've been working with since February. We have been trying to develop deeper relationships among DC agencies, federal agencies, and I'm talking specifically of the workers and the unions, and trying to develop a network and ecosystem of resistance and fight back. So ever since like late February, early March, Fun put out a national call in order to organize like town hall locally. And this was sort of in tandem with the sort of what we saw on mainstream media, which was like, when the Republicans and Democrats were on recess around the budget reconciliation bill in March, folks were raising hell, right, around public services and Social Security and layoffs, which has been affecting local economies. And we know that right here in DC, right? So we wanted Fun to do an effort to basically host a town hall in order to build out where we have relationships in these agencies and where we're organized and how we can actually coordinate a strategic fight back among the federal government.
Okay.
Go ahead.
I'm sorry, we're kind of running out of time, but I want to thank Dante for helping to organize this town hall on Tuesday. And I'm going to ask April to say a few words about the town hall. And I'm also going to ask April to jump in at the very end of the show and remind people of the date and time. But before we move in a moment to talk with what's happening with our veterans, and the rally coming up on Friday. April, tell us why not only federal workers should think about coming to this rally, to this town hall meeting on Tuesday, June 10th, but why community members should consider coming as well.
Absolutely. And I unfortunately haven't had the opportunity to work on this specific town hall, but I was able to participate in the last one. And I think that what we have to remember, all of us have to remember, is that this is not just a federal worker issue, it's a worker issue. It's a working class issue. It's about how capitalism exploits labor and silences voices. And that, when federal workers are targeted, it sets a precedent, right? It's just not about jobs. It's about respect. And I think we have to remember that and show up in every way possible. Protest, be your thing.
Yes. And it's about organizing. I'm sorry to cut it.
Oh, that's fine.
But Dante could just share very quickly some of the speakers who will be at that town hall meeting Tuesday, June 10th.
Yeah, so initially we had Sarah Nelson coming to speak, but they just had a contract negotiation issue with the AFA.
Okay, so you only have a minute.
So now we have Joe McCartan, who's been writing some very powerful articles around PATCO and the strikes from the 1980s around Reagan, but trying to do a bigger fight back with the current moment that we're in, which is worse than PATCO. And we're also having some representatives from NTEU, national, and some local rank and file organizers and workers as well participating in a panel. And we're trying to attempt to create a stronger network and storytell what people are doing within their agencies to resist these attacks on our public service and workforce. So that's the main synopsis.
Yes, and you also have some faith leaders involved as well. So again, just repeat the date and the location.
Yeah, so it's going to be June 10th, which is next Tuesday, from 5:30 to 7:30 p.m. at the John Wesley Amy Zion Church, which is near Logan Circle on 14th Street.
And for more information, is there a website or a way for people to find it?
Yeah, the registration link is too long for me to spell out, but there's...
Let me plug the Instagram Feds Work For You, all one word, and you can get information about the town hall and lots of other actions in DC there.
Okay, Feds Work For You on Instagram for those people who can get onto Instagram. Feds Work For You, the word YOU.
Yes.
Okay, thank you very much, Helen. Thank you very much, April. Thank you very much, Dante. And we're going to move right now into our second portion. And again, all the speakers here on this hour are involved with a very important national movement called the Federal Unionist Network. And this person coming, and I'm very excited to have him on, calling all the way from North Carolina, James Jones. He is a veteran. He's a member of the Federal Unionist Network, and he's going to share with us what is happening on Friday, which many people probably do not know about, and also what is happening in general with the cutbacks that may happen and the impact of the cutbacks that are already happening with the VA. With that said, we're going to give an imaginary drum roll of applause to James Jones, calling in from North Carolina. Welcome, James.
Well, thank you, Joni. Glad to be here.
And we're glad to have you. We're glad to introduce you to our listeners. I had the blessing of spending some time on the phone with James, and I'm very thankful and impressed with him and his commitment and his background. So just in a brief sentence, maybe tell us a little bit about your background before you went into the Gulf War, and then briefly about the Gulf War, and then we'll also come up more to the present. But tell us a little bit about where you're from, etc.
Sure. I grew up in rural Western North Carolina. Joined the military right out of high school because there were very limited opportunities here in this area, still are, but. I joined the military in 1989. The Army was stationed in Germany for a few years. We were deployed to the Gulf, Southwest Asia theater in I think fall of 1990 when the Gulf War was starting to build up. But ended up serving during that conflict. Came back stateside for a few years. Got off active duty, but stayed in the active reserves till about 1997. And as I understand, if I understand correctly, you suffered, during that involvement with the war, and perhaps still are suffering from the post-traumatic stress. But share just a little bit of the impact. I know this is a big question, but an impact that the serving in the Gulf War had on you as a human being. Yeah, I was a combat engineer. These are the folks that go out and use demolitions and to destroy things and build obstacles and that sort of thing to halt the enemy and a multitude of other unrelated tasks. But yeah, I served with the 2nd Armored Cavalry Regiment. It was an armored unit that our unit kind of came around and closed the door on the northern border of Kuwait during that conflict to prevent the Iraqi army from escaping. I saw quite a bit of action. I lost a few guys in my unit. Had a couple of guys, severely injured that got maimed up pretty bad. I suffer from PTSD. I also suffer from a lot of the effects from oil well fires, burn pits, the smoke from burn pits, and all the other toxins that are in that area of the world. It was a pretty dirty place to be, actually. Still suffer today from it, from a lot of the effects of that war, along with a lot of other veterans, I'm sure,
Absolutely. And we last week we had a 2-hour Memorial Day show on this show from 10 a.m. to noon. People can go to our website and listen, but we did have several vets who, including someone who is related to our station, still suffering in his 70s from post-traumatic stress disorder. But maybe just briefly, I had to even ask you this, but share with us the impacts of on you personally, some of these health challenges that you have to deal with every day.
Yeah, thanks to being exposed to all those toxins, I have sleep apnea. I have to wear a CPAP machine
to get a decent night's rest. Yeah, PTSD. I see a counselor pretty much on a biweekly basis. I mean, it's one of those things that's cyclical. You know, you think you're okay, and then something happens that triggers that memory. You know, and sometimes it's hard to explain what it is, but you know, something happens in your day-to-day living that triggers that, and you know, it causes you lots of sometimes stress and depression, and you know, the gamut of mental emotion, so to speak. So, yeah, it's not something that's easy to get over. And I'm sure a lot of vets would probably agree that, it's something you have to live with. I hope some people are able to get through it, but by myself, I struggle with it quite a bit, and it's hard on your family too. You got to be mindful of them. It's not their fault sometimes that you get upset. So yeah, it's tough.
It's tough. And I want to give a shout out. Last week we had a man by the name of Tom Hilliard, who happens to be the uncle of Calvin. You can listen to Calvin on the House of Soul every Saturday morning from 10 to 12. And the host of the House of Soul is it's his birthday today. So we give Lance Reynolds a happy birthday shout out. But thanks to Lance's assistant there, we got to meet Tom Hilliard, who just talked about the fact that he served in the war in Vietnam, has been going to the VA for assistance, but basically says that there really is no treatment for post-traumatic. There's no cure. It's something that I guess most people have to live with for the rest of their lives, which I guess I didn't quite realize that there really is no effective treatment for post-traumatic stress that we know of. Let's just jump in, James, and we'll mention it again, but let's just announce or share what is happening on Friday related to veterans.
Yeah, there's going to be a rally, a fairly large rally there in D.C. on the mall. It's a veterans rally. I think the fund, AFGE and Unite for Veterans are some of the partners that are sponsoring this rally. So I'm gonna fly up Friday morning for that rally and hopefully maybe get a slot to speak to the crowd there. I've been trying to reach out to Will Addig, the AFL-CIO Union Veterans Council head, to try to get a slot there to try to work in 5 minutes or whatever I can get. So yeah, I'm looking forward to that. I think it's important that people get to that rally, veterans and supporters and military families and the like, to show this administration that we're not going to tolerate cuts to the VA.
Yes, and I'm going to ask you about that more in a second, but listeners, the rally starts at 2 p.m. on the mall, and it hasn't been promoted that much in the DC area that I know of. That's why we're sharing it now on the radio. It's a rally supported by veterans organizations that work with veterans and labor. The labor movement is very much involved with this rally on this Friday. That is June 6th at 6 p.m. But James, share with us a little bit about the VA and what I know that there's potentially a very, very serious major cuts to the VA, which perhaps we have not heard enough about, but there already is, you're seeing some effects with what's happening to the VA in terms of support. So share with our listeners what you're seeing. And also we'll announce that James is also a federal worker with the National Park Service, and
roughly 83,000 positions, and that's been put on hold by federal court order indefinitely, I guess, until it's litigated or decided by the Supreme Court, however it goes with that. But
you're saying that was potentially 83,000 workers from the VA that the president or others want to
right.
fire.
That's the proposal that's still on the board.
Something happened here.
Oh, I think I lost you there.
Yeah. Can we Am I being heard? Oh,
Yeah, I can
boy.
hear you.
Okay. So tell us about the those potential cuts of 83,000 and where we stand with that.
Yeah, that currently, I think all the proposed rifts across the government have been paused until it's been litigated at the Supreme Court, and the decision's been made to either go through with the rifts or allow Congress to weigh in on the reorganization and the reductions in force. But we don't need 83,000 positions cut at the VA. The VA is already understaffed by roughly 50,000 positions. I know folks that do some of the disability ratings. They're on mandatory overtime right now. They're required to work 25 hours per pay period every 2 weeks because they're so short staffed processing disability claims for veterans. We don't need cuts.
And what is the impact of them having to work 25 extra hours a week?
Well, I mean, numerous things. It prolongs a decision on their disability claims, and they're human beings. So if you're overworked, you're probably not going to be making good decisions all the time when it comes to rating a person's or a veteran's disability claim. I know if I work a lot of hours, I'm not the same mentally or physically to be able to make sound decisions. So that's just one group of employees that the VA needs to hire more of, especially since after the PACT Act, the promise, honoring the promise to address Comprehensive Toxics Act was passed by the Biden administration in 2022. They were somewhere upwards of 2.5 million veterans that have filed disability claims since that legislation was passed. And the VA did hire more folks to help with that. But the other thing with that is there's still not enough of those people to rate these claims in a timely manner. I think the average time now is still around 120 to 150 days after the veteran files a claim to get an answer.
Wow.
That's quite a while,
Yeah, absolutely. And I know, is it correct that there's been a long-term effort to privatize the VA?
That's true. And I think that's the goal of this administration. When he was in the first term, they started that by outsourcing a lot of the disability claims appointments, the medical appointments. Mm-hmm. And it's not slowed down. It's just they're trying to get more and more of the private sector, for-profit medical industry involved with Veterans Affairs and veterans health care. I think that's the ultimate goal in many ways, is to fire unionized VA workers so we can privatize all the VA out, or most of it, to the private sector. And that's not good for veterans, because VA folks are specialized in their job fields. They know how to take care of veterans. The private sector, not so well. I mean, in some ways, yeah, but take mental health, for instance. I don't think the civilian sector, private sector mental health industry is capable of addressing the unique, dynamics of veterans' mental health. I think that needs to be left to the VA.
And right now the VA does have, and I know some of them that are veterans themselves and work for the VA and provide support, mental health support for veterans.
That's right. My counselor himself is a Gulf War veteran. He understands my plight, my situation better than anybody. He was there. He served in an infantry unit, so he understands totally.
Absolutely.
So I think a lot of people will lose. A lot of vets who have mental health problems and other problems are going to lose, a valuable resource if that's taken away. And it's not right, because this country made a commitment to honor our veterans a long time ago, and we will fight. We will fight to keep our benefits that we've earned and deserve. And this rally coming up on the 6th is going to be a way to express that.
Absolutely. And we'll get to the rally again in a moment. But I just wanted to ask you, with your work with the National Park Service, and again, you're a federal employee, and that's another reason why you're an active member of the federal unionist network. You're already seeing, and I've heard the same in DC, some impact since in the last few months of cutbacks with the National Park Service in terms of keeping up the parks.
Yeah, so I've worked for MPS for 24 years, and we've always been somewhat cash strapped. We've been we've been severely handicapped by staffing shortages, but since the Trump administration's rolled in, it's gotten worse. We're under a hiring freeze like most federal agencies. We already don't have enough people to take care of what we have, especially at big parks where I work on the Blue Ridge Parkway. It's a very large park, a lot of facilities that we can't open this year because there's just not enough staff to handle the maintenance and operation of these facilities. And also in North Carolina, we had a major disaster last September with Hurricane Helene, and it caused a lot of damage. And some of these areas on the parkway can't be open because we don't have the staff. We're still recovering from that disaster. So, it's been a slow process of trying to clean up and get things somewhat back in order for the tourist season here where I live in Boone. And
yes.
it's not good. A lot of these facilities are going to stay closed. By the simple fact they're either, we haven't been able to clean up or there's not enough staff.
Yeah, so that's why listeners and community members need to be working together. We need to be working together with labor and activists to make sure that all these things that have been fought for definitely since my parents' time period, generations have fought for these services. So we need to make sure we have them. James, I want to ask you real quick. You shared something with me, and I'm not necessarily going to be, I'll just say I'm not necessarily in support of the last president, certainly in terms of what he did with the promoting really the genocide in Gaza. But you shared that President Biden actually provided some very important services related to veterans and exposures that they were having from I don't know if it was only the Gulf War, but from other wars. Can you just share that briefly with the listeners?
Yeah, sure. When he signed the PACT Act, that expanded care for a lot of veterans that have recently served in Afghanistan, the Iraq War, the Gulf War, and Vietnam. And so it opened up a lot of health care options for these veterans, too, that may have been previously denied health care with the VA for whatever reason. So, yeah, it wasn't just the Gulf War. It wasn't just, certain people. It opened up a lot of health care options for millions of veterans.
And that's now being cut back.
Well, that's the proposal. The Heritage Foundation, the conservative group that wrote, Project 2025. If you go to, if you look at that document, they talk about getting rid of the VA's current rating schedule. How they want to go in and reevaluate some of the disability ratings and lower them, and then take away some other non-service connected services. And that's a whole big subject I won't get into because we don't have time. But if you get a disease later down the road, like cancer, that should be presumptive under the PACT Act. They want to take that away.
They want to take away a lot of things. Let's, I'm sorry to say we're running out of time, but let's spend the last few minutes we have. We only have about 2 minutes or so left, or maybe 3. Tell us again what's happening on Friday and why people might consider participating.
So there's going to be a rally on the mall Friday from 2 to 5, a veterans rally. I read something where 20,000 people are expected to attend this rally, and this rally is going to send a message to Congress and the administration that veterans aren't going to tolerate cuts to VA health care. If there's one group of people that they've picked to fight with, they're going to regret picking it with veterans because we know how to fight. And we're not going to take it lying down. I'll tell you that. But not just that, but as a whole, the VA is a service just like Social Security and other agencies, HHS and the like. Veterans are federal workers that work for a lot of different federal agencies that provide care and services to the American people. So it's not just about veterans itself. It's just another message to say, hey, You're not going to curtail or cut government services without a fight.
Yes,
hope
and again, there's been, I haven't heard much about this rally. So listeners, keep your ears open. I know there are other rallies happening over the weekend, but this one is Friday at 2 p.m. in the mall. Is there any way, James, that people can go to any website to find out more about it?
Yeah, I think Veterans for Unity is a good site to go to.
Okay, Veterans for Unity. Mm-hmm.
Yeah, that's a good site to go to. AFG I'm a member of AFG Local 446. I think they have something on their website, afg.org. The AFL-CIO Union's Veteran Council, I think they have a site. I think they're one of the main organizers of the event.
Can I interrupt? This is Helen. There's a website, Unite for Veterans, the number 4.org. So unite number 4 veterans.org. And that's where you can get information and say you're attending.
Right.
That's
right.
terrific.
Yeah,
that's right.
I had the wrong name. I'm sorry.
No, that was close. But that's the website, unite number 4 veterans.org. And while Helen's there, Helen, just one more time, give listeners the details about next Tuesday, because we're almost out of time.
Oof, let me try. So Tuesday, 5:30 to 7:30, it's the AME Zion Church on 14th Street, Battle for
federal workers. Battle for federal workers.
Federal workers on the front lines. Yeah,
and
we hope you can make
that
it.
is a week from tomorrow, June 10th.
That's right.
A week from tomorrow, Tuesday. Okay, thank you, James. Thank you, all the Federal Unionist Network members who were on the show today, and thank you, Magic Mike. We're going to go out with a song by Nikki. Nikki, welcome back.
Thanks, Tony.
If you want to say anything about the song, or just jump right into it.
Sure. So this song, it's an older civil rights song called Rich Man's House. And we modified the lyrics a little bit for you today. So leaving us with a little hope and defiance in the face of everything that federal workers and everyone else are experiencing right now.
And again, Nikki is with the DC Labor Chorus, and she's also very involved with these rallies.
Thanks, Tony.
Mm-hmm.
Well, we went down to the rich man's house and we took back what he stole from us, took back our dignity, took back our humanity. Well, we went down to the rich man's house and we took back what he stole from us, took back our dignity, took back our humanity. And now we're out in the streets, out in the streets, out in the streets. Oh, we're out in the streets, ain't gonna let fear mongers take our democracy. Well, we went down to the White House and we took back what they stole from us, took back our dignity, took back our humanity. Well, we went down to the White House and we took back what they stole from us, took back our dignity, took back our humanity. And now we're out in the streets, out in the streets, out in the streets. Oh, we're out in the streets, ain't gonna let warmongers take our democracy.
Thank you very much, Nikki. Nikki with the DC Labor Chorus and more. And if you go out to these rallies, you can hear her singing. I want to thank the Federal Unionist Network, also known as FUN, and it is fun to work with them. They've been on these airwaves before. We're going to continue to have them moving into the future. I want to give a special shout out to Dante, as well as to April, to Helen, and James calling all the way from North Carolina, talking about the Rally for Veterans this Friday at 2 p.m. at the mall. Thanks to Magic Mike, and stay tuned to WPFW, Jazz and Justice Radio, 2 p.m. You can hear Dr. Watkins talking about our health, but stay tuned for the radio station for the people.